Hello, my name is Savannah Webker, and today I'll be presenting a poster by the title Adverse Childhood Social Relationships and Obsessive-Compulsive Disorder. And I'll also be addressing the implications for counseling and cultural identity. This poster explores how negative social relationships during childhood can go on to influence the development of OCD and how counselors can use this knowledge when working with clients. Starting off with our introduction, we have to understand that childhood relationships play a very important role in emotional and psychological development. Interactions with peers, guardians, and teachers help shape how individuals view themselves, others, and even the world around them. When these relationships are supportive, they can promote resilience and healthy development. However, when they are negative or harmful, they can increase the risk of mental health difficulties later in life. Research shows that adverse social experiences during childhood are associated with higher levels of depression, anxiety, and OCD, and even suicidal behaviors in adulthood. OCD is characterized by intrusive thoughts, known as obsessions, and repeated behaviors, known as compulsions. An individual performs these to reduce their overall distress. Understanding how early relational experiences contribute to OCD symptoms can help counselors better assist and treat clients. Moving on to the purpose of the poster, I want to explore the connection between adverse childhood relationships, OCD symptoms, and I mainly want to focus on how negative interactions with peers, guardians, and teachers go on to influence mental health outcomes. In addition, this poster will also highlight how cultural identity can shape how individuals interpret these experiences and how counselors can use this knowledge to improve their overall treatment. The research highlighted in this poster comes from a study conducted by Anderlarky and Gooding 2021. The study included 783 adult participants between the ages of 18 and 73. Participants completed several psychological measures to assess symptoms of depression, OCD, suicidal behavior, and their overall view of their childhood social relationships with peers, guardians, and teachers. The goal of the study was to understand how adverse social experiences during childhood might influence mental health outcomes in adulthood. The findings from this study showed that negative childhood social relationships were significantly associated with higher levels of depression and OCD symptoms. One of the most important findings was that negative peer relationships, such as bullying, was often the strongest predictor of mental health problems later in life. Negative experiences with guardians, such as controlling behavior, also contributed to psychological distress. On the other hand, experiences with teachers, such as feeling underestimated or unsupported, were also associated with mental health outcomes, but these relationships were somewhat weaker. The study also found that depression and OCD symptoms, especially, would go on to explain the relationship between adverse childhood experiences and suicidal thoughts or behaviors. These findings suggest that even small, everyday social avoidances, not only severe abuse, can have long term psychological consequences. Cultural identity can influence how individuals experience and understand their childhood relationships. Cultural values surrounding authority, family, roles, and social belonging may shape how individuals respond to criticism, rejection, or conflict. For example, in some cultures, social belonging and pure relationships may have an especially strong influence on identity and emotional well being. Additionally, cultural stigma surrounding mental health may discourage individuals from seeking treatment for OCD symptoms. Because of this, counselors must approach assessment and treatment with cultural sensitivity and awareness. Moving on to counseling implications, there are several important counseling implications that can come from this research. First, counselors should assess childhood relational experiences when evaluating clients with OCD symptoms. Understanding a client's experiences with peers, family members, and authority figures can provide important context for their current mental health struggles. Second, evidence based treatments such as cognitive behavioral therapy, or CBT, and expose and response prevention, called ERP, remain the most effective treatments for OCD. Third, counselors should incorporate trauma informed approaches when working with clients who have experienced adversity in childhood. Finally, cultural response counseling is important when exploring how family dynamics, social expectations, and identity go on to influence a client's experiences and coping strategies. In conclusion, adverse childhood social relationships can significantly influence mental health outcomes across the lifespan. Negative experiences with peers, guardians, and teachers may contribute to development of OCD symptoms, depression, and suicidal behaviors in adulthood. By recognizing the role of early relationships and experiences, along with culture identity, counselors can develop more effective and cultural response treatment approaches for individuals living with OCD. Thank you for taking the time to view my poster. And I will just do a little overview real quick. There you go. Thank you so much.